I have just about every single toy you could imagine.
Yeah. And
But
you can give multiple answers. It's okay to have multiple answers. That's all right.
no, but I think the one piece of technology is a 3D,
Okay.
is a 3D, and the reason is for diagnostic purposes. Like I literally remember I was in a study club and arguing with an endodontist in our study club. It's like, how could you not? And I had the 3D before. I was one of the first. I think I was the first general dentist to get it in town, and the only others that had it were oral surgeons. And I remember having a conversation about it. It's like, how could you not have this? Like for diagnosing, knowing exactly how many canals there are. And they were, this individual's, arguing with me, like almost to the point of like gaslighting. It's like, well, I'm a specialist. That's how I know how many canals there are. But like, if you have this technology,
Yeah.
you know, you know, it's like cheating. It's like knowing like what's going to be on the exam. Like, here are the test questions,
Yeah.
you know, and um, and for diagnostic purposes and for patient education or co-discovery, I mean, that is it's the ROI is immeasurable on that.
Now, let me be a devil's advocate for. I'm completely 100% lockstep with you on that. But if we have a listener that's thinking, Steve, well, hey, I've got an imaging center 3 blocks away. Why can't I just send them there? I know the answer to that, but I want to hear your answer to that.
I mean, there's nothing convenient about that. Like nothing. There is nothing like um today. I don't know, like 4 or 5 new patients a day. There's nothing like walking 20 feet, and automatically being on the same network, pulling it up on the computer screen and say, Gary, this is why your tooth hurts.
Yeah.
And then you show them with the mouse, the bone loss, at the end of the root, this, you look over here, can you see a difference? You ask questions. Um, it is, you are missing the boat.
Yeah.
Um, you're missing the boat if you don't have it in your office. Now,
Well,
some
and I'll,
states like Michigan, they make it hard. I get it. I get it if you live in Michigan, but for the other 49 states,
by now,
um, yeah, get it, get it.
yeah. I'll add something else too, Steve. I know patient service or customer service is very important to you. And if we now have to send someone down the street, we lose control of that. If we have that in your office, we know how your team members are going to treat your patients. And that's another reason beyond the clinical reasons, another reason why you want to do that in house.